Hello and welcome to the program. I'm Sophie Scott. A discovery about prostate cancer suggests that future cases could be preventable. Scientists say 2 common viruses show up in more than half of all the prostate cancer samples they've studied, and there's already a vaccine available for one of them. The link between cancer and viruses is well known. Certain strains of the human papillomavirus can cause cervical cancer, while the Epstein-Barr virus, which causes glandular fever, is implicated in head and neck tumours. Now researchers have found those 2 viruses in prostate tumours.
We've been looking at viruses that are known to cause cancer, and we've been able to identify them in prostate cancer.
Approximately 50% of the samples contain both papillomavirus and Epstein-Barr virus, which is quite high.
Scientists looked at 100 prostate cancer samples. The purple spots on this slide show the presence of both viruses. While it's too early to say that the viruses cause prostate tumours, scientists suspect that they interact to change the cells.
We suggest that they could be causal because both are known to cause cancer in other organs.
The good news is that if the human papillomavirus does cause some cases of prostate cancer, there's already a vaccine for it which is about to be rolled out to Australian boys. To see whether the viruses are causing tumours, researchers will now recruit 50 prostate cancer patients. They'll examine old samples of prostate tissue to look for any trace of the viruses. Hallucinations, delusions and irrational behaviour. Those are common signs of schizophrenia, but there could soon be a way to diagnose the disease before the symptoms become so severe, and it could be as easy as a blood test. At the moment, there's no way doctors can diagnose schizophrenia based on a physical examination. Instead, they use psychological testing and an assessment of the patient's symptoms. But that may soon change. Scientists at the University of Newcastle are working on a blood test to see if a patient is at risk of developing mental illness.
Ultimately, we'd like to have a blood test that we could potentially identify people with schizophrenia early on.
Researchers studied 188 people. 112 of the samples came from the Schizophrenia Research Bank.
We looked at tiny RNA molecules called microRNAs, and we looked at how the expression or how the abundance of these tiny RNAs changed.
They found a large number of the molecules in one chromosome. The researchers also found that some patients with schizophrenia have particular patterns in their blood which can predict whether or not they'll suffer cognitive problems.
This could be useful for identifying patients which will have more difficulty and poorer outcomes in the long term.
And it might help work out which patients will respond better to different medications.
It means we can target their treatment much better toward their actual profile, because not all schizophrenia patients are the same.
Scientists now plan to do a larger trial on a few hundred patients before the test can be used in hospitals. It's been 10 years since an alarming study linked a key treatment for menopause with a high risk of breast cancer. Many women abandoned hormone replacement therapy, but doctors say they did so unnecessarily. A decade of research shows that the benefits of HRT outweigh the risks, especially for women who started early enough. But the country's health regulator, which is responsible for product warnings, is yet to be convinced. Rebecca Barrett reports.
Margaret Miller suffered extreme symptoms of menopause for more than 2 years before turning to hormone replacement therapy.
It was pretty uncomfortable. You know, you're sitting in a meeting room, you might have 20 other people in that meeting, and all of a sudden it looked like your head started to leak with water.
The 56-year-old was aware of the large US study in 2002 linking HRT to a higher risk of breast cancer, blood clots and strokes, but she was desperate.
I would have taken a cyanide tablet. I didn't care as long as it stopped the sweats.
The study scared off a lot of women, but a decade of research has revealed the test cases were flawed and most participants were aged over 60 and not newly menopausal.
It wasn't aimed at women who we would normally treat. I mean, you weren't allowed in the study, for example, if you had symptoms.
It resulted in extreme warnings on products and limited treatment options, even though experts agree HRT is safe and effective for women in their 50s.
I think a whole decade of women have missed out on the option of that treatment. It's not for everyone.
It makes me very angry because really there's no other human condition I can think of that we treat people so badly.
A spokeswoman for the Therapeutic Goods Administration says the regulator is aware of calls to revise extreme warnings about possible side effects of HRT products, but she says a comprehensive review is needed first. For now, the safety information is considered current.
South Australian dentists say parents have a bigger role to play in tackling rising rates of tooth decay amongst children. They say many wrongly believe it can't be prevented. James Hancock reports.
These children have been taught how to keep their teeth healthy.
You need to brush your teeth twice a day, morning and night. And you need to eat lots of healthy food and a little bit less candy.
But an online survey by the Australian Dental Association found 35% of parents say their children only brush once a day.
60% of parents think that decay is inevitable in their children. And the Dental Association is saying, no, it's not inevitable.
A recent report from the Australian Institute of Health and Welfare found a steady increase in decay among South Australian children, affecting baby and adult teeth. The Dental Association's advice is simple. Practice good oral hygiene, visit the dentist regularly, and have a healthy diet with plenty of tap water containing fluoride. The association says rates of decay are worse in regional areas, partly because of long waiting lists. It says some patients in the Riverland and South East are waiting up to 2.5 years for non-urgent care.
The sooner we can get rid of those waiting lists, the sooner people in the public system can be getting regular dental checks, which they're not getting at the moment.
The Dental Association says research shows 1 million working days are lost due to dental health problems each year.
A northern Victorian town is still living with the legacy of the floods that swamped the area nearly 5 months ago. Its hospital was badly damaged and has been operating out of tents ever since. Now, as Danny Morgan reports, the old hospital may have to be demolished and locals fear it may never be rebuilt.
They've been operating out of tents for the past 4 months, but the nurses at Numurkah Hospital aren't complaining.
We're warm. It gets a bit scary at night sometimes when the wind blows, but no, it's good.
The nurses have put up with the odd leak from the roof and a midwinter heating breakdown to continue providing urgent care for hundreds around the district.
Can I listen to your belly?
It saved Bec Fothergill a half-hour drive to Shepparton when her daughter Reilly was ill earlier this month.
We could have went to Golden Valley Health, but we're a bit put off going there. You have to wait a few hours for non-urgent cases.
When the tents were first set up in March, it was thought they'd be needed for only 3 months. But the damage from the floods is far worse than anticipated, and authorities now say it will be up to 2 years before services return to normal.
It's not good news, but what can you do? We just make the best of what we can.
The task of fixing the main hospital building is so big, engineers aren't sure it's worth it. They'll decide soon whether to continue on or demolish it and start again. Hospital Chief Executive Jacque Phillips says insurers and health department officials will make the final decision soon.
It's an old building, there's all the wiring and all the plumbing and everything that has to be reinstated, and that just needs to meet current standards.
The tents will shortly be replaced by more spacious portables. But with the future of the main building in doubt, some locals fear the hospital won't be rebuilt and that services will be relocated to Shepparton.
We've all got to be positive and go forward. And hopefully the government will come to the party.
The state government says full services will be returned.
Australian scientists are using computer gaming technology in a bid to make it easier for blind people to read Braille. They've found that very fast readers use the part of the brain that governs hearing and sight as well. Lynne Davis learnt to read Braille 10 years ago when retinal disease robbed her of sight. She admits she'd like to read quicker.
I think I want to become a faster Braille reader than I have been, and to use 2 hands instead of 1.
Researchers at the University of Western Sydney are using gaming technology to gain more insight into how Braille readers translate bumps on a page into meaningful text.
This has given us a deeper insight than has been possible up until now into the subtle movements in the way that they read.
Infrared lights are attached to the reader's fingertips. An infrared camera then tracks the fingers of readers like Samantha Ogilvie. Blind from childhood, she can read Braille as fast as sighted people can read text.
I guess it means everything as a university student and someone that studies literature in particular. I couldn't function without my Braille.
And now we're going to do the bridge.
Scientists have discovered that very fast Braille readers use the part of the brain that governs hearing.
So you can think about, as they move their fingers across the Braille dots, it creates a vibration in their fingertip, and they are processing that vibration in their fingertip. Very similar to the way that we process a speech signal.
The goal of the research is to improve how Braille is taught, to help the increasing numbers of older people who are losing their sight. Scientists are seeking anyone who uses Braille to take part in their study. A national conference has heard that more mothers are resorting to giving birth without help because they're unable to get a midwife to support them at home. It's a practice that's recently attracted criticism. Jacque Street reports.
Mothers and midwives from Australia and overseas have come together to unpick the issues facing women who choose to give birth at home.
I really believe it is a human right of every mother and to choose where and with whom she will have her baby, even if that's nobody.
Although less than 1% of deliveries in Australia are registered as planned home births, the idea is contentious, particularly when a health professional is not involved. Last month, 2 coroners in separate cases in South Australia and New South Wales found babies' lives could have been saved if mothers had not chosen home births. But new research shows people who have babies at home are well educated, with 70% obtaining a university degree.
They certainly were not uneducated or, crazy. They really carefully considered it.
Midwife and researcher Melanie Jackson has also discovered that for women outside hospital, the unassisted or free birth is often not their first choice.
For some women, they couldn't afford it. Others didn't have midwives close enough to them. Others found midwives, but the midwives weren't willing to give them what they particularly wanted.
Midwives say they're hampered by legislation, insurance costs and other red tape.
The Australian government has made several changes to the way that midwives need to be insured, and for some midwives that's become financially unviable.
The home birth supporters hope the 2-day conference will encourage governments and the medical profession to support more midwives working outside hospitals.
And that's all for the Health Quarter. If you have a story, idea or comment, find us on Facebook and click like to be kept up to date. And I'll see you next time.